Dr. Shraddha Deshpande. I'm a consultant plastic, reconstructive and aesthetic surgeon with Wockhardt Hospitals, Mumbai. Today I'll be talking about a very interesting and a common problem which a lot of people face, which is scars. Now, scars can occur because of various reasons, and the treatment depends on the reason and the location of the scar. Now, there can be scars which can be post-infection, for example, scar which has happened because of chicken pox or because of acne or due to pimples. Now, these are the scars which are most commonly seen on the face, and we'll be talking more about how to treat them. Now, there can be scars which can occur post-trauma, which can be in form of abrasions or which can be in form of lacerations or cuts. There can be depression in certain areas. There can also be scars which can happen post-surgically in case the wound has been sutured in an emergency and there are these crosshatch marks which are seen on the skin, on the face. There can be a special type of scar which is called as a keloid scar. So, I'll be talking more about each of these scar conditions. Now, the post-infectious scars which are the post-chickenpox or post-acne scars are usually box type scars or pitted scars or pigmented scars. So, the treatment will be depending on the depth of the scar. If it is a very deep scar, then we may have to do something called as subcision, which is removing the tethering of the scar to the underlying tissue and then filling the depression with either with fillers or with fat grafting. Now, fat grafting usually involves the use of fat from your own body, which can be used for resurfacing of these scars. Similarly, even for chickenpox scars which are pigmented, which are depressed, we can do something called as a dermabrasion, which is removing the superficial tissue of the scar and then filling up the depression with fat grafting. Now, there are post-surgical scars, or as we see these cross-hatch marks when the suturing has been done in an emergency setting. For this, the ideal treatment would be a scar revision, or if it is a wide scar, it may even require serial excision or it may require a flap surgery. Now, there are certain special types of scars which are keloids. Now, keloid scars are very aggressive, hypertrophic, angry looking scars which may cause itching. They spread beyond the borders of the initial scar, and there are certain areas in which these scars are more commonly seen. These are seen on ears, post ear piercing. If there is an infection, then there can be ear keloids, or they can be seen on shoulders if there is a cut or a boil on the shoulder and that has healed and that eventually leads into formation of a keloid scar, or it can be seen commonly in the chest area, which can be post-infectious or even after a major surgery like a chest open heart surgery. So, even these keloids can be treated by a multimodality approach which may involve the use of certain topical agents, silicone gel sheets. It may involve the use of intralesional steroid injections which may have repeated sessions, and it can also be treated surgically by excision with full thickness skin grafts or even certain dermal substitutes. So, the bottom line is scars can be treated, and the treatment of scars is very individualized, very customized, and we at Wockhardt Hospitals can present a number of options for treatment of scars. So, in case you are suffering with scars, please do contact us and we will be happy to guide you. Thank you.